Okay, thank you. I have 3 questions, but I'll be as quick as I can with them. With the amendment regarding the physician's professional knowledge recommendation being added, after we had our talk yesterday, Dr. Pan, I continued to do some research, and I was on the CDC website and, trying to figure out, okay, you've got personal belief exemptions. We have the religious exemption. There's also the medical exemption, which is still now within SB 277. So what I was finding was with this amendment, would you say that SB 277 would still conform to the CDC guidelines regarding a medical exemption?
There's no requirement in the law, and I challenge you to find any text in the existing code or in the bill that states that the physician has to exercise any more than their own professional judgment. That professional judgment, of course, subject to review by the medical board. And I mentioned the medical board has never investigated or removed the license from someone for granting a medical exemption for immunizations. So the law very clearly states it is up to the physician's judgment. The existing law, we've taken an amendment to clarify that point. The Department of Public Health doesn't review the exemption and has to approve it or review it. Right? It's simply the physician writes a note to the school saying that there is what's the reason, duration, which could be indefinite, could be forever if that's an ongoing condition, and they sign it, and the child now has a medical exemption. It is very straightforward, very simple, and it's really the physician exercising their professional judgment about if the immunization could cause a harm to the patient.
Well, the question is really about the CDC, what they're requesting.
Well, the CDC has guidelines, but those are guidelines from the CDC. The CDC has guidelines for a lot of things, and so they're used by physicians to help us be able to be sure we're applying the best science and knowledge. Right? They take and that's what they provide. But it's not a mandate or requirement that physicians, there's nothing, again, in the bill or existing code, I challenge you to find it, that says that a physician has to apply only the CDC guidelines.
Okay.